deserve that, that introduction for a lot of reasons. I have a unique opportunity to keep you awake for the last 30 to 45 minutes. Nelson went like 30 minutes over, so I have at least an hour to talk. And not only that, but I'm also a pastor of a church, so I can talk for hours on end. Standing up here today is so challenging for me for a lot of reasons. As you heard in my bio, I was in the crowd in Las Vegas when the mass shooting took place. And I wear a tattoo as a memory to so much of what happened that night. I remember the sights and the sounds. I remember jumping on top of my wife, praying to God that I would not get hit, and at the same time that I could protect my wife in the event that I did. I remember standing up and hearing my wife say that our friend Nicole was still on the ground laying face down, and she had been hit. And Nicole would never get up. And so the last few days have presented a lot of challenge for me internally. My wife's at home right now. She's sending me text messages. She's crying, and she doesn't want to go out of the house because she's reliving those memories all over again, and she's in fear of walking in public. And all I want to do is be home. So as much as I love standing up here doing this, all I want to do is go home to my wife and my kids. And yet I'm 100% confident that part of the reason that my life was preserved was to stand up here right now. I'm not here to motivate you. If you follow me at all, you will know that I say often that motivation sucks. It's garbage to look to external factors to try and drive what is deep down inside of us. But what I want to do is take the opportunity over the next 20 or so minutes to help you see what I hope and pray is the true solution to the problem that we're fighting in America. And that's the health of every single person in America. Yes, costs are out of control. Yes, the bukas are a problem. Yes, pharmacy costs are through the roof. But those aren't the true problem. The true problem is right here. It's so easy to get caught up in all of the problems and pointing the fingers all the way around at everything else. But what about what is right here? Mental health is out of control in this country. And instead of our industry rallying around opportunities to address mental health, we're fighting with carriers. And we can fight those fights, but we have the power to do something that can save lives. We're sicker as a country than we have ever been. The employer groups that we serve, we all know the statistics, right? 3 out of 4 people that work for our employers carry a curable chronic disease. 2 out of 4 of those employees carry 2 or more curable chronic diseases. And yet more often than not, when we're going to those employers, we're talking to them first about what? Cost. Even when we start trying to integrate wellness programs into those plans, we're doing it to what? To drive down cost. Direct primary care is one of the best innovations we have seen, definitely in my lifetime in medicine. And why are we using it? Oftentimes as a tool to what? To drive down cost. You see the theme here. We forgot why we got into this business. We have an opportunity to save people's lives. They're dying every single day. Whether it's by way of a mass shooting or by way of dying from diabetes that could have been cured by just changing their habits if somebody would have spent enough time with them. I have some slides, but I guarantee I'm going to be all over the place. I think words matter when we think about the idea of being a health champion. And a lot of you are not going to like me by the end of the day, and I'm really sorry. But this is just who I am, and this is what I do. Words matter. When we think about being health champions, we want to understand these words. Health, the state of being free from illness or injury, or a person's mental or physical condition. When we think about healthcare, and we've heard this talked about by many of the doctors that come up here, when we think about healthcare in America, we're often talking about sick care. We're not talking about caring for people's health. You know, I'm an avid CrossFitter. It's something I'm very passionate about. It's a way for me to just to let out all of my anger and frustration, to deal with the anxiety that I have post-traumatic stress, or that I have from post-traumatic stress. It's a way to stay in shape and to live a healthy life. But one of the things that I love about CrossFit is they talk about this health continuum. And they talk about this idea that there is sickness, there's wellness, and then there's fitness. And we need to be pushing everybody down that continuum. We don't want to keep people on the verge of going back to being sick. And yet, our system is designed to only see them when they get sick. Again, not to implicate anybody, and I don't remember enough names to even implicate you personally, but I've heard this said today, even when we're talking about direct primary care, right? If I can keep them, and I know this wasn't said directly, but if I can keep them out of here, if I can just keep them healthy, then I don't need to see them. And if I don't need to see them, then I can make more money off of them, right? That's not the goal. The more we see them, the more opportunity we have to be proactive in their health. Because if we can catch them as their markers start to drive up and we can catch diabetes before it's diagnosed, we have an opportunity to prevent them from being on the medication in the first place. That's health. Health is not preventing sickness. Health is about being proactive to allow them to get fit, to run around with their grandkids and their great-grandkids. I mean, this is the first generation being born now that is not going to outlive the previous generation. That's mind-blowing. Health. But also, it's about being a champion. I love that first definition. And I just ripped these off of the internet, and the internet's obviously true all the time. A person who has defeated or surpassed all rivals in competition. That's the kind of champion I want to be a part of. That's how I want to be named. And I'm really good at fighting and arguing about things, and I'll do it on behalf of anybody else that wants to be argued and fought for. And we have a sick population that is crying out for solutions. We saw the rise recently of high deductible health plans backed up with HSA plans, and if we just funded those things and they would go to the doctor and they had money to do that. And I know I was a part of that. I worked for a broker for a few years. As a matter of fact, that was even one of our strategies when we started partnering with Sedera in the first place. And guess what? They still didn't go to the doctor. Because why? Because HSAs will continue to grow. I mean, that's the highest tax-advantaged way to save money for retirement, right? We were actually preventing them from going to the doctor because we weren't truly championing their health. We were just trying to provide cost-saving strategies to keep them from being pissed off and going and finding another broker to hire. You laugh. How often is that in the back of our head when we're out there fighting the fight? And I understand. I'm compassionate about the same things you are. I have a wife and kids at home. And I will do anything to make sure that they eat and to make sure that they have a roof over their head. I was coaching a high-performing producer, and he calls me about 3 weeks ago now, and he says, look, man, he says, I'm really struggling. He said, I have this big book of business. He's got about a $4 million book. And he said, I'm sick and tired of being part of the status quo of brokers. I'm sick and tired about doing things this way, and I don't want to collect commissions anymore because I don't want to be a part of that. I want to move all my clients for fee for service, and if they're a part of something bad, I want to move them to something good, but they're not listening to me. What do I do? He's got a wife, and he's got 3 little kids at home. He goes, I feel like maybe I should just walk away. And I said, don't be stupid. You need to be here. You need to fight for your family. You need to do what's right. Just have a plan to move towards something that's better than where you're at with them right now. He cares about the people that he's serving, and we should too. I don't know that this was the tone that they were hoping for at the end of the day today. I'm never coming back, am I? Dr. Dale, he's not even in the room, thankfully, I don't think. Oh, he is, dang it. But I care. And I know so many of you do too. But that means that we need a gut check on ourselves. And there's 3 capacities that we need to consider as health champions, and really about making a difference in this world. Hopefully, again, about the livelihood and about the health of the people that we're serving. Number 1 is around our emotion. Are we passionate about health? Not health care, not health insurance, not even, I love you guys, healthcare cost sharing. Are we passionate about health? Do we get up out of bed every single morning and are we excited about the opportunity to make a difference about the health in this country? Does it get us fired up to know that as we see Sedera serving 300,000 members over the next few years, that those are going to be 300,000 more people that will have a fruitful life, that they get to go out and live and serve their communities and be a part of the world that they are living in? That's what should excite us when we see those numbers. Is that here in the heart? This is a community. Are we treating it that way? Secondly, it's in the head. You know, when I went through all the things I went through in Vegas, clearly I'm still not recovered from. And when I went through that, man, it was just a punch in the gut. I was working for a good company. You don't love everything about your job, but it was pretty good. And all of a sudden, I just realized that it wasn't everything I had been called to do. That I had to have this mindset shift. That yes, I was doing some good things, but there was greater purpose out there for me. But it required a shift in mindset. And I walked away from a significant financial opportunity as the result of it. And clearly my talks don't get me hired. We have to think differently. Feeling differently and thinking differently are so important as we think about championing health. And lastly, is in the physical realm. Do we model health? Now, I had an interesting bit of conversation earlier with somebody. I'm not going to call him out by name. And he says, well, look at me. He goes, I'm a little bit overweight and I'm not the perfect model for health. It's not what this means. But by and large, you've been in enough rooms over the years with brokers. We don't model health very well. Half the room goes out on every break, and sorry if you do this, but they're just smoking up a storm, and they're out all night drinking their life away. And so it's are we consciously thinking about our own health? Are we consciously thinking about the things that we're putting into our body every single day? It doesn't have to be perfect, but we have to be modeling good behavior if we're going to ask people to behave well. Are you active? Do you actually care about this vessel that you live within? I love so many of Sedera's values. And Dr. Dale has said over and over again about how deeply his faith drives the things that he does. And I believe that God has created me with a very specific purpose. Very, very unique. And it's eternal. But I must also focus on now. And if my body is not healthy, I will not be able to continue to do the things that God has called me to do here while on earth. To serve and care for the people around me. So it requires us to look at our own heart, to look at our own head, and to look at our own physicality. And determine whether or not we are modeling the things that we're asking other people to do, to extend their life. And then all those other natural outcomes and benefits will result. If they're healthy, guess what? Costs go down because utilization goes down, or the right utilization is what comes to be. And they're not abusing the system anymore. And then guess who we don't need? We don't need the insurance companies. We don't need all of these super expensive treatment plans that are out there because by and large, we are driving the right results because of the right behaviors. So when I started this path of fit health, I have this grandiose vision, okay? And Sedera is the critical foundation. But that's not where it could stop for me. So I'm proud to say that we are 5 weeks away from launching what will be, this isn't a sales pitch, the first ever direct primary care clinic inside of a CrossFit affiliate in the United States. Yeah. That's not my brainchild, it's just my prodding of the doctor. But we have a doctor that's a member of our gym. He works at an urgent care facility in Southern California. He hates his job because of the ridiculous things that they're asking him to do, prescribing Z-Packs for everybody that comes in with a sneeze, right? Because that's just what people ask for. And so we got talking, he and I and the owner of the gym, and we said, here's the perfect model. You're in a gym. You've got to be in a good gym. CrossFit gets a really, really bad rap for injuring people, right? Let me tell you why people get injured. Because people don't know what they're doing and the coaches don't know what they're doing. And so they're not directing people on how to truly care for their bodies. But we're pairing them. They're in a gym. They have a membership. So they're trying to actively take care of themselves. And it's not people that are all jacked. We get more people that are overweight and out of shape in our gym of 300 members than we do of people that look like, I don't know, the cover of Men's or Women's Health or something like that. And so they come into the gym, they start working with a coach. The coach assesses them to determine where they're at in their physical fitness and to help them set up a nutrition plan to make sure that they're doing reasonably decent things with what they're putting into their body. From there, they go to the doc and they have a membership with the direct primary care facility. Within that membership, one of the coolest things that doctor is offering is a quarterly assessment, biometric screening, body fat testing, and mobility screening, diagnosis. Through that, the doctor is then going to provide back to the coach an assessment and a directive on how to take care of that person and best help them make progress in wherever they want to go. We've partnered with a couple of physical therapists and other doctors in the gym that if we need some additional services outside of what that doctor orders, that we can do that. And then guess what? God forbid they get into an accident or they have some large diagnosis. They have Sedera. And they have a community that's going to support them when they need them the most. And we're working to extend relationships with other physicians in the area. We're going to start by offering that to the local community, and that's going to expand. And our hope, our dream, and our vision is that we can make this work and demonstrate the effectiveness of this model in about 90 days or so, and then we're going to go out and do it again. Because CrossFit, though I will never partner with the organization, the corporation, CrossFit as a whole is really making inroads into this idea of moving from a fitness organization into a health organization. And so they're certifying doctors all throughout the country. There's about 1,100 doctors, I think, that have been certified as CrossFit trainers that are also members of gyms. So they're starting to integrate this in together. So the opportunities are going to extend far beyond Southern California. Because we believe this is going to be one of the best ways to control health outcomes, which is ultimately what we want to do. And then we'll start going to employers and letting them know, hey, give us your sickest people. And we'll show you that we can put them on a plan as long as they're committed to getting out of the problem that they're in right now. It's not going to work for everybody, but it's going to make a huge difference for the people that are committed to doing something about their life and about their health. But we've got to model that first. And so we're doing everything that we can to do that. So what about us and what about you? So here are some recommendations that I have for this room. And I know it's exciting to hear that as Sedera partners, you guys are at the cream of the crop. That you guys are doing so many things so right, and we've heard so many over just one day, and we're going to hear about more tomorrow. And I'm excited to be a small part of all of the wisdom and all of the success that is in this room and will continue to happen in this room. But as I think about then where do we start to ensure that we make the next right step is to check our heart, to change our mind, and improve our health. Wherever you're at, we can all make some improvements somewhere. You know, there's a great quote that Gandhi, that's attributed to Gandhi, and many of you probably know it. He said, "Be the change that you want to see in the world." I love that. I'm not going to ask you to do anything that I'm not going to try. That doesn't mean I'm going to be successful. That doesn't mean I'm going to do it right the first time. But I'll go, and I'll try, and I'll take every risk necessary. I walked away from a job to take a new risk. And I will continue to put myself out there in places like this to challenge people to do the same thing. For some of you, that may be completely abandoning the relationships you have with the traditional insurance world because it no longer aligns with your vision and your value to do what you believe is right. And I don't think that's for everybody because I don't think they're the enemy. They're just a part of the problem. I like how Dr. George just said a couple of minutes ago. She's not at war with everybody else in her network. Most of them get along. And the rest of them, she says, she's just being herself, just being her. I'm sure she ticks a lot of people off. But she's okay with that because she's willing to put herself out there. And what's the best way to start? To keep it simple. We all have these crazy big dreams and visions, and high performers, we are the most susceptible to just going for it all at once. And I loved the slide earlier when Dr. Dale showed this incremental growth of Sedera. My wife and I and our two kids became members of Sedera as a result of a trip that Dr. Dale made out to Southern California back in 2015. And I have been so excited to be a part of the community and been so blessed by the journey that I've been on. But I remember going to my wife. So I'm working for an insurance broker. I was licensed. We'd been married already 13 years at that time. And so Dr. Dale came out He'd met with the team, and the president of our company said, well, if we're going to sell this to our clients, we were doing group at the time, he said, we should probably try it first. And I think we were with Kaiser, and with Kaiser, everything is easy. And so my wife was used to just going to the doctor, right? Show an insurance card, take the kids in, run them through the ringer. You could go upstairs to get one thing done, downstairs to get another thing done. You could drive through and get your immunizations and flu shots every year. If you're laughing, that means you don't know. You could literally drive through, you stick your arm out the window, they give you your immunization, and you keep going. Google it. They're going to lie. It's the truth, I promise. and so that was how easy my wife thought healthcare was, right? Just go and do that. And so I go home to her one day, and I'm like, babe, you're never going to believe this. I said, I have an opportunity to save us $700 a month. That was the differential in what my company was paying for Kaiser for me and what I was coming out of pocket for versus what Sedera was going to be with our HSA funded and everything. And so, I mean, of course, right? We've been married this long. I'd never done wrong by my wife. She trusted me with everything. I'm a licensed insurance broker. And so when I said that, she said, no way. No way. Trust me. It's going to work. I said, just give it a year. One step at a time. Let's see what happens. Begrudgingly, she took the risk. And little by little, my wife, I got to share this earlier, my wife has become responsible for the health of our family in a whole new way. The first time that she used telemedicine, she calls me. She's like, you're never going to believe how easy it was for me to get a prescription for one of the kids. And I'm like, no, duh. Of course it was. But somebody else had to tell her because clearly she wouldn't believe me. And then she had a partially torn meniscus. And could you imagine what that would have been like going to Kaiser? Getting the runaround, not getting the right treatment. We called our member services person, we submitted the need, and man, that was one of the smoothest processes possible. So I don't know if that was God's blessing down on us or some like tricky thing Sedera did behind the scenes, but my wife was then sold. And she now advocates for it all over the place. But it started small and taken one step. And now she's sold forever. When I left that company and went out on my own, you want to know what the first thing my wife said was? What's going to happen to our Sedera membership? And I said, don't worry, I'll take care of it and make sure. And that was one of the leaps out to me forming an association and becoming an affiliate of Sedera. And I am proud to continue to advocate for an organization that has the values they do, but then the long-term vision and desire to do something that has never been done before. They're not just another healthcare sharing organization. We talk about the others like they're the same, and they're not. They're different. And there's a reason. Part of it's because of the people in the organization. But the other is because of the people in the room like this that are willing to put their own livelihoods on the line and their own risks on the line to do what's necessary to drive true results in this world. We have an opportunity and we have a responsibility. Let's take it. And so this last piece is my final challenge to you. Who signed up for the workout tomorrow morning? Oh, wait, not the yoga. Sorry, I know that's a workout too. I didn't mean it like that. Sorry, Susie. Anybody signed up for the boot camp tomorrow morning? Okay. You're going to get me one more time for about 45 minutes. I am. So here's what we're going to do. You've got a card in your field notes. Tomorrow morning, we're going to set what's called a baseline. It doesn't matter where you're at. We're going to do a combination of sit-ups, air squats, and burpees. And guess what? You're going to get a minute to do each one of those things. And if you do one, that's amazing because you took the step. And then 3 months later, on your own, you're going to be challenged to repeat that same thing all over again. And someone's going to have to watch you to trust that you're doing it and doing it right. And you're going to log your score. And along the way on your journey and whatever that looks like and the commitment that you've made, we're going to share that. And we'll share the hashtags for what that is. But we just want you to be part of something that the rest of the world can see. That we are a community that stands strong together, that desires to be the change that we want to see in the world. Thank you, guys.